Tranexamic acid. What is it and why is this such an important drug that you need to know about? Stay tuned to Rohrich Knows Best. Welcome to this series on tranexamic acid. Why is this such an important, well-known drug that's so safe, but yet we're just at the beginning to know what its capabilities are beyond medicine and in the field of cosmetic medicine and cosmeceuticals? And I'm here today with Mr. Paul Stewart, who's co-founder of Tranexamic Technologies and Skin Stasis Skincare. Welcome, Paul.
Thanks, Rod. Nice to be here.
It's great. I've known Paul for at least a couple of decades, right?
Yes.
Yes, and I got to know Paul when I was at UT Southwestern, and he was truly the president of an amazing company that did craniofacial instrumentation. And it was an amazing company. We use it a lot in craniofacial surgery and craniofacial trauma. And obviously, he's not only an innovator, he's a lawyer and so much more, but he's also somebody that's always thinking ahead. So we're going to talk about tranexamic acid.
Great. Looking forward to it.
Well, good. So let's take a deep dive into what it is. So what is tranexamic acid? It's a synthetic derivative of lysine, and it's an antifibrinolytic agent, which is really one of the most important original uses. It prevents the breakdown of blood clots. And it's gained a lot of popularity in dermatology and cosmetics, and it's used to decrease bleeding, surgery, and trauma. So what got you interested in this incredible medication?
Really is just by chance. One of my former colleagues at the company that we worked with before, the craniofacial company, got involved probably 20 years ago with tranexamic acid. And we started out working in the orthopedics field.
Yeah.
We had some patents that we were pursuing different uses of tranexamic acid. So we've been working on this for a long time, and I feel like that's given us a basis for being real experts in this, and we can apply that expertise to the cosmetic and plastic surgery.
Yep. And it's, of course, used in every orthopedic surgery case, every orthopedic trauma, general surgery trauma. So it's been used for many decades, so it's very safe. And its mechanism of action is that it inhibits plasminogen activation of the plasmin. Now, that's a lot of mumbo-jumbo, but really it prevents fibrin degradation. It stabilizes the clot. So I use it every day in the facelifts and rhinoplasty. When I'm done getting all the hemostasis, I spray it in and also give it IV, and it minimizes bruising and swelling, and it's amazing. And of course, the dermatologists use it for management of skin pigmentation, right?
Right. And to go back one step, the fact that it's a analog of lysine is very significant. Lysine is one of the 20 or so amino acids.
22, yeah.
Yeah, and you count them, I guess. But in any event, it's one of the 3 positively charged amino acids, along with arginine and histidine. And so they play an outsized role in all the things that proteins do, combining with other proteins, creating structures. And so if you have an effect on lysine, do a number of different things. And that's, as we see in this, tranexamic acid has a number of different roles, and you wonder, how can it stop bleeding?
Right.
How can it affect skin discoloration and a number of things? And some of our research indicates some other very interesting aspects, but that's the reason why it blocks it can either block or enhance the effect of lysine, and that's why it can do so many different things.
Yep, and it's very safe. As I mentioned it, exactly. We use it in rhinoplasty and facelifts to minimize bruising and swelling, enhances recovery. The topical, I use it topically, I use it IV, and you and I have done some really excellent studies, which we'll get into a little bit later.
Right.
But, its use in dermatology has been well known in melasma and hyperpigmentation. And of course, it decreases UV light pigmentation issues. And of course, it can be used synergistically with lasers and chemical.
Right. Now, one of the other issues about safety with tranexamic acid has to do with its structure. So they maintain the functional part of lysine, but added a structure that keeps it from being incorporated into a protein. So So if it's dosed properly, it will perform its function, usually blocking something that lysine is doing, and then it's fairly rapidly metabolized out of the body.
Right.
It doesn't have side effects. So particularly when it's applied topically, is essentially no way for there to be a side effect.
Right. Yeah. And I agree. And of course, I use it IV as well. I mean, topically and IV, it's got long, many decades history of safety. So I think, it's just a natural transition to use it topically as also in the cosmetic medicine and surgery industry. And I think that's really incredible. And I think we're going to talk about that in its emerging uses, in laser resurfacing, to decrease the post-inflammatory hyperpigmentation, which I've been using one of your products that we're going to talk about. And then, of course, we combine it with microneedling. And it's a great, safe alternative to hydroquinone.
Right,
and because hydroquinone has its upsides and downsides.
Right.
So, and it has an incredible potential for treating rosacea and redness, which, of course, dermatologists have used for a long time.
Right, right. And the thing about use of either in oral form or topically, the effect is about the same. But there is a small percentage of people who don't react well to pills, at least to these pills, and so they get stomach upset and have to stop. So in that respect, topical can be an advantage and works depending on the application, the same as or slightly less well than oral form or intravenous form.
Right, exactly. In fact, what we found is that, even in a very topical form at a higher percentage, it actually acts directly on the area.
Right. And compared to hydroquinone, and a number of other things in that category make your skin more sensitive to sunlight.
Right.
And tranexamic acid does not do that. In fact, it actually protects you against sun damage, which is
amazing. It's amazing.
Yeah,
it's
and
amazing.
There's a reason for that we can talk about.
Yeah. No, and we're going to talk about that in the deep dives that we're going to do. And then what about its safety, Paul? I mean, obviously, it's pretty rare to have any type of events or complications with it, as you mentioned, unless you do it in really, really high doses. IV, I've given it IV to my cosmetic patients for years, and it's really, and again, it's in lower doses. It's really phenomenal because it's really dose and duration.
The concern was that it caused clotting,
right?
Which would never really made sense because that's not its mechanism of action. Clots are there; it'll keep them stronger, but it doesn't cause clots. And it took years of research for people to finally accept that and feel safe about it. So it's something that. The only real serious side effect they've had is a very small percentage of people get post-operative seizures after heart surgery.
But at very high doses.
At 10 times too much of the dose, which now they know to avoid.
Right, yeah, and my anesthesiologists have told me about that numerous times, but yeah, that is in like 10 or 20 times the dose that we're talking about. Both the IV or topically. I mean, I don't think you could even come close to that topically.
Yeah, for what you do, that's
Paul?
correct, yes.
Yeah. No, you couldn't. So I think, some of the key takeaways here are that it's very versatile, it's very safe, and it reduces bleeding and bruising in plastic surgery because it keeps the clot on. It doesn't cause clots. And it's a great pigment issue. And the thing that we're going to talk about in the next podcast is what is its incredible role in aesthetics and skincare. So Paul, in the takeaway here, I want the viewer to know about tranexamic acid, but also its safety and its efficacy in medicine and then now in aesthetic surgery. So can you tell the viewer why it's so safe and why it has so many potential uses?
Particularly when applied topically, there is a minimal systemic impact. So it just doesn't go into the bloodstream. It stays in the tissues where it is. So in cosmetics, that's a key issue. Even for surgical uses, if you're applying it topically, that's also relevant. So it's a big part of its safety factor. And as I mentioned, there are a number of different uses that people have found over the years. For example, the pigmentation issue. That was discovered by chance. A doctor was giving his patient tranexamic acid in pill form for hives, basically, and discovered that her melasma got better. And nobody had really envisioned why that would be, but they've studied it now, and they basically know why it is. It's a cosmetic issue. So it's widely used against melasma, but also now other types of pigmentation issues, rosacea, both dark spots and red spots.
Right, and post-inflammatory hyperpigmentation after lasers or chemical peels. And the great thing is it's not sun sensitive, which is really, really important.
Right.
And it doesn't have a lot of the side effects that hydroquinone has. In fact, hydroquinone is banned in some European countries by the EU.
Yeah. Well, I tell a lot of my friends my age who aren't so concerned about the pigmentation and lines and wrinkles, although their spouses may be. But I tell them this is something that will help protect you against sun damage, whether that's just dark spots, but also perhaps more serious things.
That's great. Well, that's an incredible overview of tranexamic acid. Its safety, its incredible uses in medicine and dermatology, and now in plastic surgery. So please give us your thoughts, give us your comments. In the next episode of Rohrich Knows Best podcast, we're going to dig deep into what is a broad array of where this medication, this cosmeceutical is heading that will be transformative for you and all of us in the care of our skin, aging, and way beyond that. So please give us your comments, give us your thoughts, and thank you so much, Paul, for joining us today for this informative podcast.
My pleasure, Ron.